Hello everyone, welcome to Physio Brainary. In this video, I'm going to explain in brief about the anatomy of pharynx. So coming to the table of contents, by the end of this video, you will be able to understand about the introduction, various parts of pharynx, various group of muscles. There are two different groups of muscles, longitudinal group of muscles and circular group of muscles. And what are the muscles that is present inside the longitudinal and circular group of muscles, and innervations of the pharynx, blood supply, venous drainage, and clinical anatomy of the pharynx. So coming to the introduction, the pharynx is a muscular tube that will be connecting the oral as well as the nasal cavity to the larynx and esophagus. So there are three parts of pharynx, and that is nasopharynx, oropharynx, and laryngopharynx. So pharynx is a muscular tube that will be connecting the oral cavity and the nasal cavity towards the larynx and esophagus. And it begins at the base of the skull and it ends at the level of cricoid cartilage, that is the inferior border of the cricoid cartilage at the level of C6 vertebrae. So pharynx will be starting at the beginning at the base of the skull and it will be ending at the level of C6, that is the inferior border of the cricoid cartilage, where it will be continuous as esophagus. And the pharynx is comprised of three parts from the superior to inferior aspects. So the three parts are nasopharynx, second part is the middle part is the oropharynx, third or the distal part is the laryngopharynx. So first part, that is the nasopharynx. So it is found between the base of the skull and the soft palate. And it is continuous with the nasal cavity and performs a respiratory function by conditioning the inspired air and propagating it into the larynx. This part of the pharynx is lined by a respiratory epithelium, that is ciliated pseudo stratified columnar epithelium with goblet cells. The postero-superior nasopharynx contains a specialized tonsils that is known as the adenoid tonsils, which will be enlarging in between 3 to 8 years of age, and then it will be regressing. So there is a condition that is known as adenoid tonsillitis, which I will be explaining in the later slides in the applied anatomy section. So second part, that is the middle part, that is known as the oropharynx. So this is present in the middle of the three parts, that is the in between the nasopharynx as well as the laryngopharynx. This is the second oropharynx, is the second part or the middle part of the pharynx, and that is located in between the soft palate as well as the superior border of the epiglottis, and contains the following structures. That is the posterior 1/3 of the tongue, lingual tonsils, that is a lymphoid tissue at the base of the tongue. Next is the palatine tonsils, that is a lymphoid tissue located in the tonsillar fossa, that is in between the palatoglossal and palatopharyngeal arches of the oral cavity, and you will be having the superior constrictor muscles and Valdes ring, that is a specialized type of lymphoid tissue that is present in between the nasopharynx and the oropharynx, which is formed by the palatine tonsils, adenoid tonsils, and the lingual tonsils. And the oropharynx is involved in the voluntary and involuntary phases of swallowing. And these are the palatine tonsils, and you will be seeing the palatoglossal arch, palatopharyngeal arch, and uvula. And coming to the third part or the distal part of the pharynx, that is the laryngopharynx. So this is the most distal part of the pharynx, that is the laryngopharynx. It is present in between the superior border of the epiglottis. This is the superior border of the epiglottis and inferior border of the cricoid cartilage, that is at the level of C6 vertebra. So this is the most distal part. Laryngopharynx is the most distal part, where at the level of cricoid cartilage, this will be continuous as the esophagus. And it is found posterior to the larynx, and the laryngopharynx contains the middle and inferior pharyngeal constrictors. So there are three different constrictor muscles, circular muscles, that is the superior, middle, and inferior pharyngeal constrictors, in which superior pharyngeal constrictor will be present in the oropharynx, middle and inferior pharyngeal constrictors will be present at the laryngopharynx. And coming to the muscles, there are two main groups of pharyngeal muscles, longitudinal groups as well as the circular groups. The muscles of the pharynx are mostly innervated by the vagus nerve, the only exception being the stylopharyngeus muscle, which is innervated by the glossopharyngeal nerve. So vagus nerve is the 10th cranial nerve and the glossopharyngeal nerve is the 9th cranial nerve. And coming to the first group, that is the circular group of muscles, and you will be having three different circular pharyngeal constrictor muscles. First is the superior, second is the middle, and third is the inferior pharyngeal constrictor muscles. They are arranged like stacked glass, which forms an incomplete muscular circle around the pharynx. These circular muscles contract sequentially from superior to inferior to constrict the pharyngeal lumen and thus propel the bolus of food inferiorly into the esophagus. So you will be having three groups of muscles. That is the superior, then you will be having the middle, then you will be having the inferior constrictor muscles. So superior muscle, middle, and inferior muscles will be contracting in a sequential manner to propel the food that will be coming from the oral cavity. And because of the sequential contraction of these three group of muscle, which will be helpful for propelling the food from the oral cavity towards the esophagus through this, with the help of these muscles, because with the help of the sequential contraction of these three groups of circular pharyngeal constrictor muscles, that is the superior, middle, and inferior constrictor muscles. And first muscle, that is the superior pharyngeal constrictor muscle. So this is the uppermost pharyngeal constrictor. It is located in the oropharynx, and remaining two, that is the middle constrictor as well as the inferior constrictor, that will be present in the laryngopharynx. So superior constrictor is present in the oropharynx, and it originates from the pterygomandibular ligament, alveolar process of mandible, medial pterygoid plate, and pterygoid hamulus of the sphenoid bone. And it inserts posteriorly on the pharyngeal tubercle of the occiput and pharyngeal raphe. And coming to the second group, that is the middle pharyngeal constrictor, that is located in the laryngopharynx, originates from the stylohyoid ligament and horns of the hyoid bone. It inserts posteriorly into the pharyngeal raphe. And third constrictor, that is the inferior pharyngeal constrictor, it is located in the laryngopharynx, and it has two components. That's the thyropharyngeal fibers that will be originating from the thyroid cartilage, and cricopharyngeal fibers that will be originating from the cricoid cartilage, that will be at the level of C6. All fibers insert posteriorly into the pharyngeal raphe. And coming to the second group of muscles, that is the longitudinal group of muscles. The longitudinal group of muscles are the stylopharyngeus, palatopharyngeus, and salpintopharyngeus. They act to shorten and widen the pharynx and elevate the larynx during swallowing. And first muscle, that is the stylopharyngeus. So it originates from the styloid process of the temporal bone, and it inserts into the pharyngeal wall. Unlike the other pharyngeal muscles, it is innervated by the glossopharyngeal nerve, that is the 9th cranial nerve. So stylopharyngeus muscle is the muscle that is innervated by the glossopharyngeal nerve, which is the 9th cranial nerve. Apart from that, all those muscles, pharyngeal constrictor muscles, as well as the longitudinal circular, as well as the longitudinal group of muscles, will be innervated by the 10th cranial nerve, that is known as the vagus nerve. And second muscle, that is the palatopharyngeus. It originates from the hard palate of the oral cavity, and it inserts into the pharyngeal wall. And it is innervated by the vagus nerve, that is 10th cranial nerve. Third muscle, longitudinal muscle, is the salpintopharyngeus. It originates from the eustachian tube and inserts into the pharyngeal wall. It is innervated by the vagus nerve. And in addition to contributing to swallowing, it also opens the eustachian tube to equalize the pressure in the middle ear. And coming to the innervation, motor and sensory innervation of the majority of the pharynx except the nasopharynx is achieved by the pharyngeal plexus, because this nasopharynx will be innervated by the glossopharyngeal nerve. So remaining all those nerves will be remaining all of those 5 muscles will be innervated by the 10th cranial nerve, that is known as the vagus nerve. The pharyngeal plexus, which overlies the middle pharyngeal constrictor, is formed by the pharyngeal branches coming from the glossopharyngeal nerve, pharyngeal branches of the vagus nerve, and branches from the external laryngeal nerve, and sympathetic fibers from the superior cervical ganglion. And coming to the sensory innervations, the pharynx receives sensory innervation from the glossopharyngeal nerve. In addition, the anterior and superior aspect of the nasopharynx is innervated by the maxillary nerve, and the inferior aspect of the laryngopharynx, that is surrounding the beginning of the larynx, is innervated by the internal branch of the vagus nerve. Motor innervation, all the muscles of the pharynx are innervated by the vagus nerve except for the stylopharyngeus. This particular muscle will be innervated by the glossopharyngeal nerve, which is the 9th cranial nerve. Apart from that stylopharyngeus, all the muscles will be innervated by the vagus nerve, that is the 10th cranial nerve. Coming to the arterial supply, so the artery that supplies the pharynx is coming from the branches of the external carotid artery, which includes ascending pharyngeal artery, branches of the facial arteries, and branches of the lingual and maxillary arteries. So these are the arteries, that is the branches of external carotid artery, which will be supplying the pharynx. And coming to the venous drainage, it is achieved by the pharyngeal venous plexus, which drains into the internal jugular vein. Coming to the clinical anatomy, for the clinical anatomy is the enlarged adenoid tonsils. So these can become pathologically enlarged due to viral infection of the upper respiratory tract. And when enlarged, the adenoids can obstruct the openings of the eustachian tube, which is located close to the adenoid tonsils in the nasopharynx, leading to a condition that is known as chronic otitis media, which in other words it is known as the glue ear. So this is all about the anatomy of pharynx. And coming to the summary, the pharynx is a muscular tube that connects the oral cavity and nasal cavity to dash and dash. The answer is larynx and esophagus. And it begins at dash and ends at the, so it begins at the base of the skull. The pharynx will be beginning at the base of the skull and ending at the level of inferior border of the cricoid cartilage, which is at the level of C6. And the pharynx comprised of 3 parts. They are oropharynx, nasopharynx, and laryngopharynx. So in order, it will be nasopharynx, then comes the oropharynx, then comes the laryngopharynx. And the circular constriction muscle that is present in the pharynx are superior, middle, and inferior laryngeal constrictor muscles. The longitudinal muscles present in the pharynx are stylopharynges, palatopharynges, and salpingopharynges. And the motor and sensory innervation of majority of the pharynx except the nasopharynx is achieved by the pharyngeal plexus and by the vagus nerve, that is the 10 cranial nerve. And venous drainage is achieved by the pharyngeal venous plexus that will be draining towards the jugular vein, that is the internal jugular vein. And dash tonsils is enlarged due to viral infection of the upper respiratory tract, that is adenoid tonsils. So this is all about the anatomy of pharynx. Thank you for watching this video. Please do subscribe my channel and share this with your physio friends and fraternity. Thank you.